I am a breast cancer survivor. I'm actually proud of the fact that I am. It isn't something that I say necessarily about myself right away. I was diagnosed 5 years ago, and I was 59 years old. I had been having mammograms since at the age of 32 because my mother died of it. I guess after I stopped menopause, I was doing breast exams, but I wasn't that regular with them. And I found a lump on my breast, and it was in the crease. It wasn't on the top. It wasn't a place I normally even checked. And I knew right away what it was. Like, I didn't even really question it. It was hard like a pea. And I said, I think I have breast cancer. So I told my significant other, and he got me in right away. And sure enough, I had 4 tumors on my left breast. They were small. I had the ultrasound done, and it was positive, and I was not surprised. I had the surgery, and I had the expanders put in. They got infected 2 weeks later, and I had to go back into the hospital. I still hadn't cried, and then I got very, very sick. The antibiotics weren't working, and they had to go in and take them out and put them back in again. But then they thought I had something called C. diff, which happens when you have a lot of antibiotics. Because I work at a hospital, I know exactly what it is. I had the chemo, and my 60th birthday I was going through chemo. I only had to have like 4 treatments, so it was 8 weeks. And then following that, I had radiation every day I could only tolerate 27 days, and I just got very, very burned. At the time, we were going through this upgrade, and I do software. And it was incredibly challenging. I'd been working like 80 hours, and it was the most difficult year of my life because I had chemo, and then I had radiation, and I had to go work and come back. But there was one thing that I will never forget that the oncologist said to me. I asked him a question. I said, "What does it mean in 5 years you're cancer-free?" He goes, "Let me tell you. If you have colon cancer and they resect the bowel and they cut off your colon and then 5 years later you're good, you're cancer-free. But with breast cancer, that is never true. And I've seen people come back after 30 years with cancer." And so at that point, that was very much of a downer. And at that point, I realized that I'm just going to live every day. And I don't think about it. I try not to think about it. I might be kind of an anomaly, I'm not sure, but I had such a huge support group. I had done volunteer work for 20 years for Komen. I knew all these people. My friends came over. Everybody helped me. My daughter was extremely strong. And because of that support network, I felt comfortable. And I try not to think about what could be. So I didn't go online. I just tried to eat right and exercise. I think going through chemo was difficult. It wasn't as bad as I thought it was going to be, but you just don't feel well. I'm the queen of denial. And that's how I made it through, if you want to know the truth. In the far recesses of my mind, I think it could come back. But I try not to think about it and live every day. That's how I feel. I was very worried about telling my daughter, and that was because her grandmother, who died when she was 5, went through a terrible time with it. She was diagnosed in the 50s. Radical mastectomy, muscle tissue lost. She had lymphedema in her arm that was so bad that she had to spend 13 hours a day on a sequential compression device machine. It was very scary for her. So that was the hardest part of the whole thing, was having to tell her. But she was wonderful and strong, and she's still fearful. More fearful than I am, for me, because her father wasn't really in the picture, and I'm her family. I think she'd be devastated if she lost me. So I knew how hard it was going to be to tell her.
Has she had any genetic testing done or anything like that?
Yes, actually she did. And she was fine. So, and I had it too, the full gamut of it. And I don't have any genetic issues. I feel wonderful. I actually think it's changed me for the good, believe it or not. I read this book called Crazy Sexy Cancer. Every day I have kale and spinach smoothie. I know some people don't think diet's important, but it's part of my regimen, and I follow this regimen every single day. And I try to meditate more. I feel empowered, I guess. I live more in the moment. I guess that's the major change. There are these fake little nipples you can put on. They stick to your skin, and I can't remember the name of them. But I bought them at Hematology Oncology, and they were great too, before I got the tattoos, because I waited a year. I brought in a Playboy picture. I said, I want them to look like this. You can get your skin kind of like twisted to have your nipples made to look more like nipples, but then I heard that they kind of collapse, and somebody gave me the name of this tattoo artist named Corinne, and she is absolutely fabulous. Because I had the reconstruction, I feel, I've lost a erogenous zone, but I still feel feminine. I don't quite feel, I guess I don't feel as sexy, and it's only because I gained a little weight, but it's not impacted me tremendously. I think of women who haven't had this, and that might impact them more. It's a choice, and I made the choice to do this. And I had the other breast removed because, number one, I didn't want it to come back there, and number two, I wanted them to match. A little vanity there, but I don't really think overall it's affected my femininity too much. The sisterhood at the Pink Therapy group has been wonderful, very supportive. You feel free to discuss any issues that you have because they've been through it as well. And it's a camaraderie that there's just nobody else. And actually, now that I think back, it was my daughter. She goes, Mom, you really need to join a therapy group. I go, I don't really need it. At first I said that. She goes, Mom, please do it. I would say the best thing to do is to find the support of a friend or a family member and have them help you go through this with them. And maybe find a support group or talk to other people. Don't be alone in the process. And don't go crazy reading all this statistics, because it's only going to depress you. Find a good doctor and ask all good questions. Be prepared for what is going to happen. Don't worry about your hair, it will grow back. You might even like it short. There's a vast network of people out there, and you are not alone. I'm participating in the Look Now project because I want to help other people. I want other people to know what I've gone through, and I feel empowered by doing so. When I first walked in, it was a little intimidating. I saw my big picture and then, oh. But everybody else was there. Everybody had gone through the same thing, so I felt good about it, but it was still a little difficult. I hope it helps others.